Assalamualaikum warahmatullahi ta'ala wabarakatuh. Greetings of peace, everyone, and good day. So, we will continue our discussion for Unit 7, Nursing as an Art, Science, and a Caring Profession, Part 2. So, this part focuses on discussing the self concept, which is an important topic in nursing because understanding ourselves helps us better understand our patients. So, in the previous video, we focused on understanding why nursing is an art, why nursing was accepted as science. Now, let's understand why nursing is a caring profession focused on understanding the self concept of an individual. So, as future nurses, you will meet patients who are experiencing physical illness, emotional stress, or social challenges. This situation often affect how they see themselves. Therefore, nurses must understand how self-concept influences behavior, health, and recovery. So now let's define what is self-concept. Self-concept refers to a person's mental image of oneself or perceptions of themselves. It includes how individuals see their abilities, personality, body, and roles in society. A positive self concept is essential or important because it contributes to both mental and physical health. When people feel good about themselves, they are more confident, they are more resilient, and able to cope up with stress. So, for example, a person who believes I am strong and capable of recovering may actively participate in the treatment and rehabilitation. On the other hand, a person with poor self concept may think I am useless because I am sick, which may lead to depression or lack of motivation to recover. Now, in understanding the self concept has several dimensions that help us understand how individuals see themselves. So, first, we have the self knowledge. Self knowledge refers to what a person about or knows about themselves, including their traits, their beliefs, and abilities. Another, we have self expectation. This refers to what a person wants to become or to achieve in the future. For example, a nursing student may say, I want to become a competent and compassionate nurse in the future. Another dimension is your social self. This refers to how individuals think others see them. So, example, a patient might feel respected and valued when healthcare professionals treat them kindly. And last dimension is your social evaluation. This involves feedback from others that affects a person's self-concept. Example, if a clinical instructor praises a student nurse for good patient care, the student's confidence and professional identity may improve. So, we have here the term self awareness, which defines or refers to the relation between self perception and perception by others. Self concept develops over time through social interaction and life experiences. So, once you have developed your self concept, okay, you will now have a good perception by the others. And if you have a good, really, what do you call this, good established good self perception, you will have also a good perception by the others. Okay, and by accepting that, okay, this is me, this is my attitude, these are my traits, these are all of me. So you will now be aware of yourself. Now, these are my beliefs, okay, I have to accept this one, and by that moment you will not coerce any beliefs to your patient because you are aware of yourself. Your judgment, your opinions cannot be changed by other people. Okay? So, according to developmental theories, individuals face different developmental tasks throughout life. Successfully managing these tasks develop a healthy concept or healthy self concept. while failure to cope up with them may lead to self-concept problems. So example, a child who receives encouragement from parents and teachers may develop confidence, while or however constant criticism may cause the children or child to feel insecure or inadequate. Now, according to Erik Erikson concepts, self-concepts develops through social interaction. People face developmental tasks and they may have success in coping or difficulty in coping. So, depending on the result, okay, there will be a positive or negative effect of your self-concept. Now, in formation of self-concept, we have to identify or we have to understand these three types of self. We have the global self, the core self concept, and the ideal self. The global self focused on collective beliefs and images about oneself, okay? The core self concept is the central and most vital beliefs and images, while your ideal self is how we should be or prefer to be. So, a low self-esteem from discrepancy between ideal and perceived self may result, okay? So, if a person, okay, if a person have no balance between these three, the global concept, the core self, and your ideal self, it may develop to a low self-esteem. That's why you have to learn what are the collective or what are your collective beliefs and images about yourself, your most vital beliefs and images, and how we should or how we prefer to be. Okay? So, we have here different components of your self concept. First is your personal identity. Personal identity refers to a person's sense of individuality and uniqueness. It answers questions like, who am I? What makes me different from others? So example, a nurse may identify themselves as caregiver, a health advocate, and an educator. Another is your body image. Body image refers to how individuals perceive their physical appearance. Example, a patient who undergoes amputation or surgery may experience changes in body image and may feel embarrassed or insecure. So as nurses, we must support patients emotionally and help them adjust to these changes. Next, we have your role performance. This refers to how individuals fulfill their expected roles in society. Examples includes roles such as parent, student, a nurse, or a community member. For instance, a mother who becomes hospitalized may feel stressed because she cannot perform her role at home. And last component of self-concept is your self-esteem. Self-esteem refers to the value or worth that a person gives to themselves. Example, a student who successfully performs a nursing skill may feel proud and develop higher self-esteem, while low self-esteem may occur when individuals constantly feel unsuccessful or rejected. So again, here are your further discussion. Personal identity, focus and conscious sense of individuality and uniqueness. It evolves throughout life, includes name, sex, age, race, ethnic origin, and culture or occupation. It may also include talents, beliefs, values, personality, and character. It distinguishes self from others. Body image is the image of physical self, how person perceives size, appearance, and functioning of body and its parts. It has cognitive aspects and your affective aspects. So it includes clothing, makeup, hairstyle, jewelry, and other things intimately connected to the person, develops from attitudes and responses of others from self-exploration, and different parts of the body have different values for different people. So body image is the sum of a person's conscious and unconscious attitude about his or her body. Role performance, again, a role has expectations, which relates what a person in a particular role does related to behaviors expected of a role. Role mastery is once person behavior meets social expectations, and failure to master leads to frustration, inadequacy, and lowered self-esteem. So for your role performance, role performance focused on role development, role ambiguity, role strain, and role conflicts, which is the role development, socialization in a role. For role ambiguity, expectations unclear, role strain made to feel inadequate or unsuited to a role, or role conflicts which has opposing expectation. So you have to identify what you need to fulfill, or what you need to achieve when it comes to role performance. So now let's talk about self-esteem. Self-esteem is one's judgment of one's or own worth. So global self-esteem is how much one likes oneself as a whole, and specific self-esteem how much one approves of a specific part of oneself. It is derived from self and others, foundation established during early life experiences, and this may change from day to day or moment to moment. So factors that affect self-concept include stage of development, family and culture. We have here stressors. We have resources, history of success and failure, and illness. So, stage of development based on at what developmental stage is the patient is placed. Okay, so accordingly we have different theories that we can experience developments or growth and development at a certain time, and during that development there are changes in our body, changes in how we see, how we think ourselves. So if that stage of development was performed or achieved, or the goal of that stage of development was achieved, then the person will have a good or positive self-concept. Okay? So for family and culture, so family is usually the first source of feedback about who we are. So, for example, parents who provide love, encouragement, and support help build a positive self-concept. For stressors, okay, so we have here the stressors affecting self-concept. We have identity stressors, body image stressors, role stressors, and self-esteem stressors. So, if this happened to a person, the individual may develop or build a negative self-concept. For resources, this may include your family, okay, the environment wherein you can what do you call this, receive feedback. So if you have plenty of, or if you have received good and enough feedbacks from others, then self-concept will be build, and a positive one may be built. Okay, so for history of success and failure, the more you succeed in life, the more you will build a more positive self-concept, and the more you fail in life, the more you build negative self-concept. For illness, okay, illness is usually affecting or building a negative self-concept. Okay, they're more on negative part of identifying ourselves, because we do sometimes people believe that illness will prevent them from doing any activities that will improve their lives. Okay, so again we have here the stressors, So, identity stressors may include changes in physical appearance, declining physical, mental, and sensory abilities, inability to achieve goals. So, another, we have body image, the loss of body parts, loss of body function, disfigurement. For role stressors, the loss of parent, a spouse, or a child, or close friend, change or loss of job, divorce. Okay. For self-esteem stressors, we have lack of positive feedback, repeated failures, unrealistic expectation, and abusive relationships. So these are stressors that could affect the self-concept. So if ever your patient will experience this kind of stressors, you have to support the patient. You have to be there, okay, to offer yourself in improving their self-concept. So if the patient is diagnosed with problems in self concept and body image, so the first thing that we do during the assessment phase is to include psychosocial assessment of client and support persons. Assess satisfaction and dissatisfaction with role responsibilities and relationship. Tailor question to individual, culture, age, and situation. Assess personal identity, their body image. If indication of body image disturbance, assess for possible functional or physical problems. If it's the problem is role performance, obtain information about relationships. So people do not always appear to themselves as they appear to others. You have to accept that. How people or how other people sees you is not the way you see yourself, and that is self-concept. However, you have to accept some criticism from others, but you don't need to change yourself if you believe that you are this good. Okay? So, for self-esteem, ask, are you satisfied with your life? How do you feel about yourself? Are you accomplishing what you want? What goals in life are important to you? So, you can diagnose a person experiencing problems in self-concept or body image, such as disturbed body image, ineffective role performance, or chronic low self-esteem. Additional nursing diagnosis for clients with problems of self-concept may include disturbed personal identity, risk for anxiety, ineffective coping, grieving or completed grieving, hopelessness, powerlessness, and parental role conflict. We have also readiness for enhanced self-concept, disturbed sleep pattern, social isolation, spiritual distress, and disturbed thought processes. As for the planning, we have to collaborate with clients and support people, include the state of health, anxiety, resources, coping mechanisms, and affiliations, individualized by characteristics of client. As for the implementation phase, you help the client identify areas of strengths and weaknesses so that you can focus on improving or maintaining your strength and then eliminating those weaknesses. So assist clients to evaluate themselves and make behavioral changes, identifying areas of strength, framework for identifying personality strengths, and stress positive thinking. Identify areas of stress focused or notice verbally and verbally reinforce client strengths. Encourage the setting of attainable goals. Acknowledge goals that have been attained. Provide honest and positive feedback. Enhancing self-esteem may include encourage clients to appraise situations and express feelings. Encourage clients to ask questions, provide accurate information, and become aware of distortions, inappropriate and unrealistic standards, and faulty labels in clients' speech. So explore clients' positive qualities and strengths and encourage clients' positive qualities and strength. So encourage expressions of positive more than negative self-evaluation. Avoid criticism and teach clients to substitute negative self-talk with positive self-talk. So sharing moments with others can enhance senior self-esteem and general feelings of well-being. As for evaluation or evaluating, the nurse uses data collected during interactions with client and significant others. If outcomes are not achieved, explore the reason. So now let's talk about the nurse-client relationship. So this is very important to understand, especially if we would like to understand nursing as a caring profession. We are focused on providing or having a therapeutic relationship with our clients. So nurse-client relationship is the relationship established between the nurse and the patient that can be either therapeutic or non-therapeutic. There are four basic roles performed by nurses within the nurse-client relationship. First, the nurse as a caregiver. So that's the first role. You perform health-related activities, contemporary caregiving role, develops close emotional relationships, and understands the illness and injury cause insecurity and uses empathy. Nurse as educator, so educates about complex healthcare, provides health teaching, let the client choose his healthcare, shares information and alternatives, and empower client involvement. This may include, you may include the patient in rehabilitation, financial assistance, and emotional support. Another role is nurse as a collaborator. You work with a team towards achieving a common goal, responsible for managing care, and shares information with other healthcare members. And you are also a nurse delegator, one who assigns a task to someone who has necessary knowledge and inspects completed tasks and accountable for inadequate care. So now let's talk about therapeutic nurse-client relationship. So the desired outcome of this relationship is to restore health. Okay? With the underlying principles of treating client as a unique person and respects client's feelings, promoting client's physical, emotional, and social and spiritual well-being, encourages client participation and individualized client's care, accepts client's potential for growth and change, communicates using understood terms and language, incorporates client support system, and implements compatible healthcare techniques, client's values, and culture. So when we talk about nurse-client relationship, it has different phases. So first phase is your introductory phase, the period of getting acquainted with your patient. The client initiates relationships and identifies one or more health problems. The nurse demonstrates empathy, active listening, competency, appropriate communication skills. Now, after introductory phase, we have working phase. Mutually planning care, enacting the plan. Participation is needed from both sides, and nurse must promote client independence. After the working phase, we have the terminating phase. The nurse and client mutually agree on improved immediate health problems, and caring attitude and compassion facilitates client's care transition. So, in establishing your therapeutic nurse-client relationship, you have to have a good or established communication. Communication is an exchange of information between two people, followed by feedback to confirm understanding. It occurs simultaneously, verbal and non-verbal communication. Factors may include affectability to communicate, attention, concentration, language, compatibility, hearing and visual acuity, motor functions, sensory distractions, interpersonal attitudes, literacy, and cultural similarity. Okay? So, to summarize our discussion, self-concept to a person refers to a person's perception of themselves. It includes several components such as body image, self-esteem, role performance, and personal identity. Self-concept develops through social interaction, life experience, family influence, and cultural factors. For nurses, understanding self-concept help us provide holistic care because illness can affect not only the body but also how patient views themselves. And in understanding or implementing the self-concept, it is very important that in doing so, okay, or helping the patient understand their self-concept or accept their self-concept or improve their self-concept, we have to establish good nurse-patient relationship and good nurse-patient communication. So by having those two components, okay, it may help the individual or the patient achieve or build a positive self concept. That would be all for this video. Thank you for watching and have a nice day.